Welcome to my channel Medicine Guide. In some cases, doctors will prescribe drugs for the treatment of insomnia. All insomnia medications should be taken shortly before bed. Do not attempt to drive or perform other activities that require concentration after taking an insomnia drug because it will make you sleepy and can increase your risk for accidents. Medications should be used in combination with good sleep practices. Your doctor can prescribe the appropriate medication for your particular sleep problems. Type of drugs for insomnia: anti-Parkinsonian drugs, benzodiazepines, non-benzodiazepine hypnotics, a melatonin receptor, anticonvulsants, antinarcoleptics, antidepressants or anti-anxiety medications, orexin receptor antagonists, doxepine, Silenar, over-the-counter sleep aids. The FDA issued warnings for prescription sleep drugs, alerting patients that they can cause rare allergic reactions and complex sleep-related behaviors, including sleep driving. They also warned people that taking sleeping medication at night can impair their ability to drive or be fully alert even the next day. Keep in mind that sleep drugs are not for long-term use. Talk to your doctor if you're still having trouble sleeping after 2 weeks. In this video we will discuss how clonazepam, Klonopin, works for sleep disorders. So let's start our discussion, but before that please subscribe to my channel Medicine Guide. Clonazepam can be used to help with sleep disorders, although it's not typically the first choice of medication for this purpose. It is primarily a medication in the benzodiazepine class, which has sedative properties and can help promote sleep. Here's how clonazepam works for sleep disorders. 1. Calms the central nervous system. Clonazepam works by enhancing the effects of a neurotransmitter called gamma-aminobutyric acid, GABA, in the brain. GABA is an inhibitory neurotransmitter that helps reduce the activity of the central nervous system. By increasing the effects of GABA, clonazepam can produce a calming and sedative effect, which can help reduce anxiety and promote relaxation, making it easier to fall asleep. 2. Reduces anxiety. Clonazepam is often used in cases where sleep disorders are closely related to anxiety or other mental health conditions. By reducing anxiety and promoting a sense of calm, clonazepam can indirectly improve sleep quality in individuals who have difficulty falling asleep due to stress or anxiety. 3. Muscle relaxation. Clonazepam also has muscle relaxant properties, which can be beneficial for individuals with sleep disorders related to muscle tension or restless leg syndrome, RLS. 4. Anti-seizure effects. In cases where sleep disorders are caused or exacerbated by seizure activity, clonazepam's anti-epileptic properties can be helpful in managing the condition and improving sleep. It's important to note that clonazepam, like other benzodiazepines, is typically not recommended for long-term use in the treatment of sleep disorders. This is due to the potential for tolerance, requiring higher doses for the same effect, and dependence, as well as the risk of withdrawal symptoms upon discontinuation. Instead, it is often used on a short-term basis while other non-pharmacological interventions and lifestyle changes are considered for long-term management of sleep disorders. If you're experiencing sleep problems, it's essential to consult with a healthcare provider. They can evaluate the underlying causes of your sleep difficulties and help determine the most appropriate treatment, which may include behavioral interventions, cognitive therapy, or other medications that are safer for long-term use. Like other medicines, these drugs also have some side effects. Let's have a look on them. Side effects. Clonazepam, like other benzodiazepines, can have various side effects. It's important to note that not everyone will experience these side effects, and their severity can vary from person to person. Common side effects may include: 1. Drowsiness. One of the most common side effects of clonazepam is drowsiness or sedation. It can impair your ability to concentrate or operate machinery. 2. Dizziness. Clonazepam may cause dizziness, which can lead to falls and accidents. 3. Lightheadedness. Some people may experience a feeling of lightheadedness when taking clonazepam. 4. Coordination issues. Clonazepam can impair coordination and motor skills, making activities like driving unsafe. 5. Memory problems. Benzodiazepines like clonazepam can affect memory and concentration in some individuals. 6. Gastrointestinal effects. Nausea, constipation, or changes in appetite are possible side effects. 7. Tolerance and dependence. Prolonged use of clonazepam can lead to tolerance, meaning that over time, higher doses may be needed for the same effect. It can also lead to physical and psychological dependence if used long-term. 8. Withdrawal symptoms. Stopping clonazepam abruptly can lead to withdrawal symptoms, which may include anxiety, insomnia, tremors, and seizures in severe cases. Therefore, it should be tapered off under medical supervision if discontinuation is necessary. 9. Paradoxical reactions. In some cases, clonazepam can paradoxically increase anxiety, agitation, or aggression. 10. Respiratory depression. Clonazepam can suppress respiration, especially when used in high doses or combined with other central nervous system depressants like alcohol or opioids. This can be life-threatening. It's essential to take clonazepam as prescribed by your healthcare provider and not to increase the dosage without their guidance. If you experience severe or bothersome side effects, consult your healthcare provider for further evaluation and potential adjustments to your treatment plan. Additionally, it is essential to be aware of the potential for dependence and addiction with clonazepam and use it only under medical supervision and for the shortest duration necessary for your condition. That's enough for this video. If you want to watch more videos like this, keep watching my channel. Disclaimer: channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only, which may not cover all possible precautions, side effects, contraindications or drug interactions. Consult your doctor and discuss your queries related to any medicine or disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine Guide.